Hi, my name is Matt Carmen. I'm athletic training student at the University of South Carolina, and my article review presentation is on the comparison of different methods in exercise therapy and shoulder impingement syndrome, a prospective randomized control trial. So this is just a picture of shoulder impingement syndrome just before I jump into everything. This picture itself is just showing the compression of the rotator cuff and subacromial bursa between the humerus and the coracoacromial arch. Shoulder impingement syndrome, or SIS, is the most common cause of shoulder pain, which is why I'm using this as my article review. So for the introduction of my article, the overall goal is to assess and compare effects of different electrotherapy methods and exercise therapy on pain, function, and quality of life in shoulder impingement syndrome. The treatment goal is to reduce pain and joint stiffness, improve muscle strength, prevent progression of problems, and bring the person back to daily activities as early as possible with a higher level of shoulder function. So this is actually seen more frequently in women with an increasing incidence by age. The painful movement limitation, there's functional deficit and restriction of daily living activities. This is also a result of overuse of the shoulder, especially in overhead positions. There's a weakness of shoulder stability, and there's various traumas that can occur. So the methods for this article, the selection criteria itself is the age between 18 and 55. There's continuous unilateral shoulder symptoms, restriction of less than 30% in passive range of motion, and then they have not undergone treatment for at least a year. There's 66 females and 17 males with SIS that were selected. 79 were randomly allocated into 4 groups, which you can see below. Group 1 was given a hot pack and exercises. Group 2 was given that plus IFC. Group 3 was given that, and instead of IFC, TENS. And then group 4 was given the hot pack exercises and then ultrasound for 3 days per week for 4 weeks. Now, the patients were also told to not use any painkillers during the treatment. There was also a visual analog scale that was used to figure out what the pain is, short form 36 to analyze the quality of life, and then there was a shoulder and hand questionnaire for shoulder functional assessment. So here are the results. There are significant differences that were observed in groups 1, 2, and 4 in intra-group comparisons of pain at rest before the treatment, at the end of the 4th week, and then post-op 3rd month. No difference between groups in terms of activity, pain before, after treatment, and then the quality of life using that short form 36 among patients of the same group showed significant differences before the treatment, after the treatment, and at the 3rd post-op month. Dash score shows that there was not any significant differences among the groups before treatment. So the quality of life, the mental component in group 2 showed significant differences between pre-treatment and post-treatment measurements. Dash and intra-group evaluations showed significant decrease among the 3 points in all groups. And then at the 4th week and 3rd month assessments, all groups showed significant improvements in terms of pain. So Dash and the short form 36 physical component scores showed a significant difference between the pre and post treatment results. And then there was no significant difference that was observed between the groups in any stage of the study period. So for the discussion, therapeutic exercises are considered effective. Most electrotherapeutic agents are used for treatment of SIS and conventional therapy to decrease pain, improve mobility, and prepare the tissue to exercise. Ultrasound and laser therapy were effective in terms of pain and function, but not superior over the other agents. And then there was treatment options that were anti-inflammatory drugs, superficial thermal applications, exercise therapy, and electrotherapeutic modalities. There are still controversial opinions for what the optimal treatment is. The goal of the conservative treatment of the SIS is to decrease the pain and subacromial inflammation to provide the opportunity for recovery and increase the function and quality of life. So this is my take-home message. The application of ultrasound, IFC, or TENS are different electrotherapeutic agents in addition to exercise therapy in the treatment of SIS, and all exhibited similar improvements of pain, function, and quality of life at 4 weeks after treatment and post-op 3rd month. There was not much variance between them, so any of those were pretty good. And then IFC did provide better outcomes and the mental component of quality of life. And then there's still more studies that need to be done for long-term follow-ups to investigate effects of different electrotherapeutic agents. Now, my personal clinical take-home message for this is that clinically, this is really important when we are working with patients, especially our overhead athletes, since this is such a common injury. It's really important for us to continue to do research and choose what is best for our athletes. And based off this article specifically, understand that using electrotherapeutic agents first may help in pain, function, quality of life before moving forward into those exercise-based therapy. The more we know, the better we are able to help our patients and incorporate a evidence-based medicine approach for our patient population. This is just a figure overall of what I was just talking about of the participation analysis. If you wanted to go back and get something more visual, this is for you guys. And then this is just my reference on my article. Thank you.